Coming up, the Senate reaches a deal on a $2 trillion economic package. We'll talk to Senator Thom Tillis next. Welcome back. Thanks for joining us, Senator Tillis. Let's begin, if you don't mind, sir, with the package the deal that was just made on economic relief for America.
Well, it comes in several different phases. One of the most important things that we're doing is trying to make it very clear to the American people who have lost their jobs, have either been furloughed or they find themselves on unemployment, that the federal government is going to provide supplemental assistance on a short-term basis for the length of time that we think will be necessary as we combat the virus. We're also making loans, some of them forgivable loans, available to businesses who keep people on the payroll, continue to provide them with health care coverage, and try to stay in business. And we will also provide loans, collateralized loans, to certain industries hit hard by the travel restrictions and various measures the federal government have taken. That's all being detailed now. I just got out of a conference call with my Republican colleagues and Steve Mnuchin to get the first tranche of information. We'll have more details we'll be pushing out later today, and we should vote later this afternoon.
That's about 10% of the GDP, right, of our budget. Is what, $2 trillion?
That's right. It's roughly, Mark, it's going to end up being right at about $2 trillion between some of the loans and grants, the money that could be in play. Not all of it out the door, but a good portion, over $1.5 trillion. And that's roughly the equivalent of our discretionary spending, what we vote on and appropriate every year.
How do the small business retention loans work, sir?
Well, what we're going to be doing, instead of just going through SBA, small business lenders, we're trying to open this up to a very broad base of lending institutions who can provide credit to businesses and under certain circumstances, if they're using the loans to make payroll. So in other words, this individual would not be on unemployment. They wouldn't be entitled to the other check that would go directly to them. A business decided to keep people on the payroll, then that portion or all of the loan that's used for that purpose would be forgiven.
How are the self-employed covered?
Self-employed are going to be covered in the same way that we do with unemployment. They will be entitled to a check. I'm trying to figure out the exact amount. Going into the negotiations last night, it was $1,200 per adult. So if, let's say you had a family of a husband and wife and 2 children, it would be $2,400, $1,200 each for the husband and wife, $500 each for the children. So that'd be a $3,400 check that will be authorized by the Treasury, distributed by the IRS, go directly to the home, and it is not a loan. It's not something that they have to pay back. It's something we hope they can use to pay their bills, pay for food as we weather the virus in the coming weeks and month.
The Federal Reserve is actively involved. They are setting up credit. What is that, about $4 trillion?
I think, what we're trying to do is use the whole of government to improve liquidity, to provide access to low-cost loans, and to really bridge the gap. If this virus follows the same trajectory it has in other countries, we could be well past the peak of the virus over the next 3 or 4 weeks. Then we want to be expecting people to go back to work, helping businesses reopen, and get our economy back on track. Just remember, back in mid-February, we were quoting job creation numbers that were historic and historically low unemployment. We know the fundamentals of the economy are there. We've just got to beat this virus and get back to that growing economy we were all experiencing in the first part of this quarter.
So with the federal liquidity and that they're putting out, they're going to help some of the bigger companies, the cruise industry, restaurants, hotels. Is that the way it's going to work? And are those loans specifically?
Well, in many cases, let's take a look at the airline industry, for example. They can get collateralized loans. These are not grants. These are not bailouts. These are things that the airlines can use to help them with their cash flow situation that was in large part caused by decisions we had to make about travel. The same is true for business. It's really industry non-specific. What we're trying to do is a broad-based relief package, and you'll see more of the details as we put the summary out today. But it's not really picking winners and losers. It's not limiting making arbitrary limits based on the size of a business. We want to help small businesses, independent contractors, people who are on unemployment, people who are getting furloughed. This is a very, very broad-based economic stabilization package.
What are we doing for our students? So we're waiving some of their loans at this point, or putting them off?
Well, what we're really looking for is forbearances. One of the proposals that Speaker Pelosi put forth that we could not accept was to give loan forgiveness. We're having discussions about loan forgiveness for student loans, but this is not the appropriate time to be talking about something that we've been debating for months and years. This is about providing short-term stabilization and trying to do our part to keep people whole, businesses whole, individuals whole for this brief period of time. Then we can have a discussion about many other things that we need to do to reduce student loan debt and other matters that happen were being discussed long before the virus ever hit our shores and will continue to be discussed.
Tell our viewers about the Defense Production Act. What does that do, and what priorities or authorities does that give the president?
Well, what it allows the president to do is direct industries that can either ramp up production of products they're already building or retool their shops to build things that are of importance. So let's take, for example, masks and gowns and a lot of the equipment that our healthcare professionals need. It just gives the president the authority to direct industries to do it. Quite honestly, the private sector is already stepping up. We've got several examples of businesses in North Carolina, textile companies that are retooling their shops and now going away from making jeans or maybe cloth for automobiles and making gowns and masks and the sterile swabs that you need for the test kits. So the industry really isn't having to be mandated much. They're all responding very, very well. It's admirable to see how quickly people are coming and asking us how they can help.
LabCorp has really stepped up, and that's a North Carolina company.
They have. They've done a good job. They're ramping up production. UNC developed a diagnostic that's also been helpful. Universities across the country, the private sector is already starting initial trials for vaccines that won't help us in this cycle, but should help us next year. There's a lot of innovation and a lot of thought going into how we beat this virus. And I think it's also going to better prepare us for a future pandemic or future epidemic.
Senator, what do you know about the malaria drug? Is that safe? Will doctors be prescribing that?
We don't know if it's safe in all cases. That's why we have to rely on people like Dr. Fauci, the National Institutes of Health, the CDC, and the private sector experts to let us know if it's effective and where it's safe. There are some instances where people shouldn't take the drug because they may have certain health conditions that for the broader population, it could be very helpful, but it could be fatal for certain people. So we're waiting. I know a lot of people want to move quickly, but we're waiting on the experts to tell us what therapies we can use. And by the way, Mark, I think there will be several more beyond this malaria drug. We're looking at a number of different therapeutics, as they call them, that have been effective against prior viruses that we're just testing so that we can figure out which ones to scale and which ones to direct the American people are the safest and most effective.
I think it's called chlorohydrin, if I'm pronouncing that right now. That is being used somewhat in New York, right?
It is on a limited basis, and that's because we're in an extreme circumstance in New York. I just called a friend of mine who lives in Manhattan last night to check on them, and they're in a very, very difficult situation there. So in more extreme circumstances, you may take more risk. As of last night, we had not had a death reported in North Carolina. I think we had about 60 hospitalizations and a little over 400 tests for positive. So North Carolina right now is not anywhere near the sort of situation we have in New York, and therefore you would want healthcare professionals and others to have to weigh different risk against a growing population of people who are getting sick. Could happen in North Carolina at some point, but right now I think we want to be very careful and not make decisions that are best made by clinicians and healthcare professionals.
Talking about the economic impact, is North Carolina uniquely positioned to weather this storm with the rainy day fund?
Well, I think we're better positioned than many other states, both in terms of the surplus we have in our unemployment fund. If you remember several years ago, we had a a $3 billion debt. Now I understand it's nearly a $3 billion surplus. A lot of that will probably have to be used in the short term, but also the rainy day fund. This is a very, very costly disease, though. So we may be in a less bad situation at the end of it. We don't know what we're going to need to spend, but I do believe that North Carolina's economy was already in one of the top performing economies in the country, and I believe that it will be on the backside of this virus once we beat it.
HUD is very involved in this crisis too, correct?
That's right. Really, it's the whole, I serve on banking and urban development committee, and I've worked very closely on that committee with Chair Crapo and Pat Toomey on various banking and HUD-related policies that will be rolling out as a part of the bill. Housing continues to be a challenge. It was before the virus. So also the disaster efforts, what we do after this, I suspect that HUD will be used as a facility similar to how it's used after a hurricane to provide other assistance after we get through the immediate crisis and identify what other impacts we're having. And it could be impacts on starts for low affordable housing, lower cost housing, those sorts of initiatives that are going to slide to the right a bit while we combat the virus.
Are we in a recession right now, Senator? And can you see it going deeper if this continues on through the summer months? And when would you expect, it's hard to say really, when America can get back to work or limit it, where there's not really pockets of the virus?
Well, we don't know how long it's going to take to eradicate it. I think we need to make these decisions on a state and local basis, though. I've had several teletown halls this week. I've talked to thousands of North Carolinians, and they're saying, why doesn't the government just shut everything down? And I've said that in cases where states are experiencing the number of incidences like New York, it probably made sense for them to do a stay-at-home or shelter-in-place orders. In North Carolina, we may get to that. We've heard a few towns and a few counties announce that, but they happen to be the more populous areas. I want to make those decisions based on data, not broad-based decisions. And I also want to encourage people who can go to what is deemed to be a safe work environment to go to work. We do need people to work if they can and they're in a healthy environment. I implemented social distancing policies 2 weeks ago in my office. Almost 2/3 of my staff are working from home. We're teleconferencing every day. And the people who are in the office are spread out. I ask them all to check their temperature before they come into work. They're using hand sanitizer. They're staying out of close contact with one another. If you've got a work setting like that, then I would encourage you to go to work unless you're in a high-risk category, you've got serious underlying health conditions, then you have to make a personal decision that you're most comfortable with.
Senator, your office is open 24/7 right now through the weekend, correct?
Well, that's right. I've told my staff that we have have been inundated with casework, but my staff are working 14, 16-hour days. We're having conference calls and video conference calls every day of the week, and we will until we've beaten this virus. And I want to let anyone know who's watching this show that if they have anything that we can help them with, they can go online at tillis.senate.gov and contact my office. I have people working. They're going to be working around the clock just like I am until we get through this and get back on track.
We may have discussed it, but FEMA's role is critical. And how are they going to interconnect to fast track getting some of these medical supplies to the key folks that are impacted?
Well, one of the key things we have to look out for, I had Congressman Greg Murphy, also a medical doctor, on 2 town halls over the last 48 hours. And he made a very good point to a first responder, a firefighter who asked a question. I believe his name was Corey, last night. And he said, we need to know we've got enough protective gear now, but we're worried about whether or not we're going to be running low. And Congressman Murphy made a very, very important point. Go to your county health agency. Make sure right now you're leveraging the typical supply chains. And then if we find out that they are coming up short, that's when we can get FEMA and federal agencies to fill gaps if we need to. What we're trying to do is just ramp up production so that we don't get to that point. But it's very, very important. If you're a medical professional, my daughter's a nurse. She's showing up to work during these tough times. If you're a medical professional, a first responder, law enforcement officer, go to the agency you would normally look to fulfill your needs and then escalate up. That ultimately gets up to FEMA and federal agencies.
Tom, you have legislation you've just introduced on price gouging. Tell our viewers about that.
Well, it's fairly straightforward. You know, almost all states have anti-price gouging laws when they declare states of emergency. But I've just heard, after talking with a couple of hospitals and doctors, they said a mask that was costing them 48 cents a month ago is now costing them $8 and sometimes more than that. I just think that's wrong. So unless the provider can demonstrate to us that their cost has gone up, we just go all the way up the chain and we find the person who's gouging, and that person could be subject to serious fines and penalties and prosecution under federal law. So what this does is it gives states another lever. They could refer gouging matters to the federal government, have the DOJ prosecute it. I just think, you know, we're seeing the best of America and the healthcare workers and neighbors helping each other out, the people opening up their grocery stores and trying to help out. But sadly, this is when you also see a little bit of the worst of America, and I want to go after those folks. I'll also tell you something else, Mark. I heard on one of my teletown halls, someone said that they had heard from someone that they could help them get their check sooner if they go register at a website. That's wrong. Anybody who is expecting getting an individual check from the federal government, you do not have to do anything, and no one in the private sector can help you get it sooner. So you're probably dealing with either somebody who's uninformed or a scam artist. I want to know about them too, because we'll go after them.
Let me ask you this. The president shut down travel from China, travel from Europe. Are we looking at domestic travel being shut down, sir?
Well, I think a lot of it effectively has. I was just checking. I actually drove up about 2 weeks ago because I wasn't really sure how air travel was going to be, and I wanted to have the option of being able to drive home when we get out of session. But I just checked the airlines. Typically in Washington, you have about 6 or 8 flights a day. It looks like there may be 2 or 3. So I think that domestic travel is effectively already being reduced. And if we have these hot spots in certain areas that have shelter-in-place orders, I would expect that there will be curtailment on travel. But I think a lot of that's going to happen organically.
Should we ask people from New York if they're coming to North Carolina to self-quarantine for 2 weeks?
Well, I think we all should do what we need to do. I'm trying to determine after we do this vote whether I should go directly home or do just that myself. I don't have any evidence of exposure. I check my temperature every morning. I think rather than give you a broad-based answer to that question, it really depends on the nature of what they were doing when they were in New York or Illinois or California or Mecklenburg County for that matter. We all need to be very conscious of the exposures that we've had, what we've been doing to really protect ourselves, and always be conservative. If there's any doubt in your mind, then self-quarantine, check your symptoms. And another thing, Mark, I have literally gotten a phone call from somebody on a cell phone who was obviously in their car or something telling me that we should have shelter-in-place orders. And I asked them the question, I said, what are you doing right now? Well, I'm out in my car. I said, then why don't you do what you're asking me to do? If we just take, there are millions of people, certainly hundreds of thousands of people, that if they're intellectually honest with themselves, could choose to stay at home, call a family member, call a friend, not go visit with them, and they can help us make this problem easier to solve if they really just think through how they behave over the next few weeks. And then we bend the curve.
Talk to us about the initial federal government response, and should we expect that we're going to see drive-through testing here in North Carolina?
We're already seeing some of it. I had a call with the director of the VA region that North Carolina is a part of. It's combined with Virginia, and they've already provided drive-through options. We're seeing that with other healthcare facilities where a medical technician can come. You don't even have to get out of your car. They can administer the test. It's in a much safer setting. And the reason why that's important is the vast majority of the people who even test positive are going to be advised to go home and deal with symptoms that are very much like a cold or the common flu. They will also ask questions that will determine whether or not you're at risk. If you come in and you test and you describe diabetes challenges that are not under control or respiratory challenges, they'll have you on a watch list and most likely, if you do exhibit symptoms, get you to a healthcare facility. And that's what we have to do, is maintain the capacity for the minor number, I should say a minority of the number of people who are going to get this virus who will actually have serious complications. The rest of us need to be prepared to deal with the symptoms and hopefully deal with them at home.
I want to ask one more time about potential therapies and the timeline possibly for a vaccine, sir.
Well, the vaccine, we've already got one vaccine in the first stage of clinical trials. It takes about a year to pass through our rigorous and appropriate test for vaccines. But I do think that the vaccine is very possibly going to be online, not for the next season, which will be November, December of later this year, but the following season. Most of these flus have about a 3-year, a 3-time cycle. We're in the first cycle now. In the next cycle, I think the drugs, the therapies that we're talking about will be helpful, and I think probably even on the tail end of this cycle. And then a vaccine is most likely our best hope for the third cycle, which would be in the fall of 2021.
What milestones will you be watching for on the curve? Particularly, I hate to talk about it, but data on death rates.
Well, I think that's one thing, Mark. All of your viewers need to understand that the more tests that we complete, the more incidences of the virus we're going to identify. But at the same time, that's going to create a bigger denominator, and I think you're going to see the death rate. The original estimates were about 4%. That's because we had very limited testing, and most of those people were they had underlying health issues that I think overinflated our sense of the mortality rate. And I'm not a medical professional, but I have been told by those who are following this very closely that this is tracking more towards mortality rate of somewhere below 1%. And I think that the more testing we do, the more we're going to see an explosion, incidentally, because we're doing a lot more tests. So we're going to see an increase in incidence, not because it's all of a sudden infecting people more quickly. It's just that we're doing a better job of testing people. And in some cases, we're getting positive tests for people who didn't know that they even had the illness because the symptoms were so minor. But that data is going to be very helpful to us. It's going to let us prioritize for the next season. And really, that data is going to be very helpful to help these clinical trials for therapeutics and vaccines going forward.
I saw the president said yesterday, and I'm sure you're in contact with the president, that our testing has now caught up with South Korea. I think that's a good sign, sir.
It is. I mean, we're a large geographic, large population country. It took us a little while to mobilize, but I'm very proud of all the hard work everyone's doing. And I will tell you, Governor Cooper, I think he's made good decisions. The president's made good decisions. They've changed some of the decisions after they made them based on best available data. And that's what we have to continue to do. This is, if you think about it, I remember Pat McCrory was talking about how when he had to respond, Governor McCrory, he had to respond to a hurricane. You made the best decision based on the track of the storm. You position assets in one place. You hope you're prepared. The storm track moves. You got to react. This virus is a lot like a hurricane. We can't totally predict what it's going to do and what damage it's going to cause. We have to be resilient. We have to be flexible. We have to be patient. We also have to be bipartisan and work together with state and local officials, regardless of party, and with people up here in Washington so that we're staying focused on fighting and winning the war against this virus and keeping our economy stable.
You're known for reaching across the aisle. Are you seeing more of that now in a crisis?
Yeah, I do. I think when you're walking through the hallways, we're going to have our differences. I mean, this virus is not changing our worldview or ideologies, but it certainly has given everybody a sense of focus. And I think it shows a good side of a lot of people up here. We can go back and have our political and ideological arguments after we get this economy back on track and make sure the population's healthy. But it's good to see that the vast majority of the members up here are checking their parties at the door and doing what we need to do for the American people and people in North Carolina.
Sir, we've got about 1 minute left. Give us a close, your hopes, what we should expect? And by the way, are we prepared to go back to the well if this continues on for months for
Well, I
more
think
money?
we got to prepare for the worst and hope for the best. One thing I do want to say, Mark, is if any of your viewers think that they're sick, do not go to a hospital, do not go to a doctor. Take your temperature, call your doctor, call your hospital, and seek their advice on what to do next. That's the most important thing, in addition to staying at home if you don't need to get out. The best way to make me not have to come back and do another level of funding or another response to the healthcare crisis is for every individual to take personal responsibility to help us fight this virus and win.
Senator, how can they reach your office again, please, sir?
Best, the website, which has all my phone numbers, is Tillis, TILLIS.senate.gov. And we're happy to help them out with any kind of casework. We do it every day, and it's one of the best parts of the job, trying to help people in North Carolina.
Sir, thank you for your time. Thank you for watching, and have a good night.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC TV.